Honorable Speaker, and I stand to oppose the motion before the House. In my response as Minister for Health. Honorable Speaker, it's very interesting because just this morning the Fiji Times in the editorial did a review, and they said basically at random they picked Fijians from all across the nation, and they asked them this simple question. I find it very interesting because it's the same day they were discussing this motion. They said, what do you think of the frontline medical team during this crisis? The First Lady said, I believe they're doing a marvelous job. The second gentleman, they're doing a wonderful job. Third Lady, they're the bravest of them all, and they're doing a very good job. The fourth gentleman, I think they have done a good job during the crisis. The fifth lady, they're doing a good job, and better every day. The last lady, excellent service. Awareness programs, superb, and I thank our frontline officers for their tremendous efforts to keep Fiji safe. Honorable Speaker, it is almost inconceivable that the Honorable Prasad has chosen this time, this difficult time, to raise this motion to continue to apply pressure on the ministry while the ministry is responding to a 1 in 100 years pandemic. We have reason to believe that this is similar to what the Spanish flu was in 1918, at this most difficult time. The motion is not considerate of the massive effort and commitment that the ministry personnel are currently engaged in, and the many resources that they have at hand to support the normative functions of the Ministry of Health and the extra normative functions of COVID-19 and the climate-sensitive diseases that we've been hit with after these 3 cyclones. There was a UNDP plus, I think it was USP or FNU study done a few years ago, which said because of climate changes and the fact that Fiji is smack in the middle of some major cyclone paths, that climate-sensitive diseases is going to be something that Fiji will have to contend with, apart from COVID-19, apart from all other things. So they are lepro, subspirosis, dengue, typhoid, diarrheal diseases, and there's really nothing we can do about it. We cannot change our coordinates. We cannot move away from the 180-degree meridian that we are on. We need to find a way to continue to crush these other things that we are faced with within the Ministry of Health. As a Ministry of Health and as a government, we are always in the spotlight. We receive feedback constantly. Apart from the complaints line, now that we have a 158 COVID line, on top of that, the public have mechanisms by which they can provide feedback into the hospitals, into the health centers. They have our phone numbers, they have our email address, they Viber us, not only me, the Assistant Minister, many other people within the Ministry of Health. And we are always transparent. We communicate with the public constantly on the health status of the country and what the ministry is doing. Honorable Speaker, if we look in a way, what I'd like to bring across today is some of the things that have been brought forth by Honorable Prasad is talking about some cosmetic issues that we are already doing and already changing. I want to assure him that since this week, we already began on the $750,000 emergency department renovations at CWM Hospital. And we were waiting for the right time. We couldn't do it in the beginning of the year because of COVID-19. Now that we know that we have a handle on the disease, we now have a bit of space to be able to do it. That's why we're now doing it. That was budgeted from last year's budget. Honorable Speaker, Honorable Prasad talked about and thanking me and Dr. Lisa and Dr. Temesa. I want to say to him today and also to the rest of Fiji, this is not a me show or Dr. Lisa show or Dr. Temesa show only. The Ministry of Health has 6,000 staff. 6,000 staff. And our young staff are at the forefront. They are the people that actually understand what it is needed to do to be able to get the job done. People like Dr. Solo in Nabua, who works at the isolation unit, who needs to be isolated when the patients recover. People like Live, the health inspector in Naita Siri, Sampria, the nurse in Lotoka, and also the water assistant at CWM. These are people that believe in the cause, and they believe that the Minister of Health has embarked on this universal health coverage and ensuring that we're going to continue to protect the nation at large. And it's not a cosmetic thing, because if rugby was dependent on the fanciness of the jersey and not on the amount of tries being scored, then Fiji will never win. Because it's not about that, it's about the function. One has to look at what is happening with COVID-19 around the world to realize that there have been first world countries brought to their knees. Italy, a second best health system in the world, brought to their knees. When you talk about health system, that's the second best in the world, brought to their knees. Because it's not about the cosmesis. It's about the whole comprehensive, collaborative thing that needs to happen within health. And he talked about the nephrologist. We do have a nephrologist, Dr. Nis. That's the name, Dr. Nis. Please remember that name. He's an Australian, fully qualified nephrologist, been working for more than a month now. I see him on a regular basis because I go to CWM every morning, Honorable Prasad. And also Dr. Yogeshni is in Lotoka, providing nephrology. So we have not lost nephrologists. We have gained nephrologists. There's been no respite to this ministry. For now, we had the measles outbreak in November. There were nations in the Pacific that suffered considerably. And I will not name certain nations in the Pacific that suffered considerably. I know for sure that in New Zealand, about more than 2,000 New Zealanders in Auckland had measles. We also have a COVID-19 pandemic since January. 3 tropical cyclones, Saratino and Harold, the flu season from February to May, and the challenges with the COVID-19 restrictions. With these responses, our resources have been tested, and yet we continue to deliver because we are supported and we have the political will of the government of the day on our side. We have the Honorable Prime Minister very interested. During this COVID-19, he was there in the Minister of Health head office on a daily basis with my senior colleagues in cabinet on a daily basis, on Saturday and Sunday, coming up to the Minister of Health, wanting to know what was happening. How can the whole of government machinery support the cause? That's the interest. That's the political will. That's the political will that I've never seen before in my 20 years as a doctor in the Ministry of Health. We've also embarked on this additional fever clinics, the mobile fever clinics. There's been 830,000 Fijians screened in the mobile fever clinics. The most comprehensive public health campaign for fever screening ever done in any country in the world. Massive cleanup campaigns. We've had only 18 COVID-19 cases. None was admitted to ICU. And I've said it before and I'll say it again. Some of them got quite sick. They were managed effectively by our people on the ground. People that are able to stay because they've been able to retain. We've been able to retain our staff because we've increased their salaries. It is extremely ill-advised now to put further pressure on the ministry by conducting an audit at such a challenging time as this. And I've seen over the last few months, since last year, this barraging of the Ministry of Health done by Honorable Prasad and his colleagues in one particular daily. Barraging of the Ministry of Health. And this is the time when we need support. Not barraging of our staff. Not trying to reduce their passion that they have, the passion that Solo has, the passion that our nurses have, the passion that our water assistants have. This is a time to support them. And make it even worse, even before the budget was called, I was getting messages from my colleagues, former doctors working within the Ministry of Health, saying, are we getting a pay cut? I said, why are you getting a, who said that? He said, it's out there. It's in the NFP website. We're getting a 35% pay cut. I said, please, don't believe that. That was the same Honorable Prasad who put in their website 35% pay cut for these 6,000 workers within the Ministry of Health, not including the rest. And now he stands here today and says, it's for review. I thank the doctors. These are the same doctors and nurses. He wanted to cut their pay by 35%. By 35%. And he's saying that they feel bad. Honorable Tikundundo says, the They feel their morale is low. The same party that wanted to cut 35% of the salaries of the doctors and nurses, 35%. They wrote it in their website, 35%. And I want Fiji to know that National Federation Party wrote pay cut of 35% for all civil service, including the same doctors and nurses and water assistants that are there fighting the cause. And they come today in the midst of the COVID-19 to come and say, we feel for them. Their morale is low. You made their morale low. You made their morale low. You made their morale low. Honorable Tikundundua, your party made the morale low by putting in your website a 35% pay cut. Yes. The strategy plan will be a rolling plan. Honorable Speaker, the ministry has continued over the last years building on the platforms that has been done from before and conducted a broad evaluation of its services and formulated a comprehensive strategic plan to address key issues. The output is the 5-year Minister of Health and Medical Services Strategic Plan, 2020 to 2025. I'm talking recent now, based on the platforms from what has been happening from before, that is well informed and harmonious by the government's 20-year National Development Plan. And I want to say that these plans is not something that I come up with. These are plans that have come from the people on the ground. They actually talk about what is needed to be able to provide a better service within this geographical area in which we serve. Noting the pathologies that we have, noting the type of diseases that we have. They participate, they come up with a plan. We give them the vision, a healthy population. They have come up with a plan that they know that we can be able to use and guide ourselves as we take this nation forward in protecting the health of this nation. The strategic plan is a rolling plan. It means every year we review because we need to be agile. That's something that Dr. Takeshi Kasai said, the regional director of WHO. He said, during this time, you have to be agile as a Ministry of Health. You have to be agile because of COVID-19 and all the types of roles that your ministries are doing, especially around the normative functions and the extra-normative functions. We've undertaken a review of our clinical services and implemented measures to address service quality and patient safety. I talked about last year how we roll out the decentralization of our clinical services, especially the specialist services, doing specialist clinics closer to our people wherever they are. During the COVID lockdown, we had Raki and Singotoko Hospital operating as hospitals, and Singotoko continues today to operate as hospital, doing emergency operations for our people within that area. We've recently completed a supply chain review, and we're ready to implement the recommendations of that supply chain review. We've been very fortunate during this COVID-19 era to have freight flights with Fiji Airways bringing back medical supplies to us. We've had a significant look at our human resource and workforce needs and looked at the administration and corporate support, the clinical areas, and public health. So with administration and corporate areas, we've incorporated human resource processes that has improved recruitment and appointment. We've appropriate people appointed to critical roles and has improved compliance and productivity. And certainly the open merit system in place has been very helpful for that. We have more exposure to specialist training, and we've also have specialization of nurses progressing well. Doctor numbers back in 2016 was 474. I keep on saying, when I started, there was about 200 of us. In 2016, it was 474. By the end of this year, we will be crossing nearly 1,000. We have more than 800 now. Public health, great opportunity for training and higher qualifications. Honorable Speaker, a scope of services have improved dramatically and widely. The ministry provides a wide range of complex clinical services which continues to expand. The services and personnel of the ministry operate under 45 current legislative frameworks which govern people, systems, services, work processes, internal and external engagements, programs, and productivity. We also have policies for different service provision, different strategies that are adapted for different needs. Different work areas require different expertise, tools and equipment and infrastructure. different quality assurance methods and different capacity building programs and varying legislations to comply with this. A one-off inquiry will never be able to do justice to the scope of services within the Ministry of Health. More likely, if done, it will be very superficial and obviously a waste of money and resources. Honourable Speaker, I've said earlier that we've embarked on this universal health coverage. We continue to expand our scope of services, but more importantly, value add all the 200 facilities and more that we have right across the country. We're expanding our clinical services over the last few years, and with the introduction of specialist services, and I've named this before, neurosurgery, urology, pediatric surgery, laparoscopic surgery, cross-linking corneal treatment, and many others. These expansions are the product of a constant review of the disease load and services mode that are appropriate and sustainable. We are all aware that FEMAT last year was certified as the only EMT service by WHO in a small island development state, in a developing nation. We have the establishment of the Level 2 laboratory facility, the Fiji Center for Disease Control, which has vastly increased our diagnostic capability in the public health arena. And we are increasing outreach services to the community, bringing and again taking the specialist health services closer to the people. Honourable Speaker, our recent efforts show our resilience. The response to measles has been applauded in Fiji and in the global health scene. WHO has commended our effort. We have 31 cases in total, no deaths, and more than 500,000 Fijians were immunized, more than 95% of the target population. In response to COVID-19, in spite of all the challenges, Fiji has been exemplary and has been invited on a number of international forums to date to share our experiences and how we have responded, knowing the resources that we have. We have had 18 cases. We've had no deaths, and we've got 83% recovery to date. Honourable Speaker, the Ministry has proven that it can step up and deliver. It has taken and shouldered both the normative functions and the outbreak response simultaneously. And I've just begun by talking about what was seen in the Fiji Times in today's paper in the editorial section. Honourable Speaker, overall we want to achieve a comprehensive population level, service level and systems level in a health system that contributes towards our goal of achieving universal health coverage. Our ongoing efforts in protecting Fijians against disease, supporting them in their efforts to lead healthy lifestyles, and seeking to eliminate the risk of unhealthy environments. Conducting an inquiry will be a duplication of the current work that we do and the advice that our people on the ground are already giving us on the way we can maneuver forward. And it's a waste of valuable resource that can be directed to other priorities. We are already progressing in many areas and have plans in place to further improve health, medical care and service delivery. The motion raised by Honourable Biman Prasad is therefore not supported. I thank you, Honourable Speaker.